Okay, ladies and gentlemen, now our doctor is about to do the Case2 procedure now. So I will introduce the patient information for you. So for this Case2, the coronary IVL procedure, the patient is female and she is currently 70 years old. And for her medical history, she has suffered chest tightness for over 6 months. And about 2 weeks ago, the patient experienced chest tightness again with the chest pain. She also has the coronary heart disease, LM lesion, and 3-vessel disease. RCA has diffuse calcified plaques in the wall, involving the entire lumen with stenosis greater than 90% at the narrowest point. LM has calcified plaques with stenosis of about 50 to 60%. The proximal and mid segments of the LAD have calcified plaques with stenosis of about 80% to 90%. The distal segment of the left coronary artery shows acceptable lumen opacification with no visible stenosis. LCX has scattered calcified plaques in the wall, with stenosis of about 60 to 70% in the proximal and mid segments. And for her past medical history, she has the history of hypertension for over 13 years, and she regularly taking antihypertensive medications, but she has no history of other diseases. For her admission diagnosis, she has coronary atherosclerotic heart disease, and she also has hypertension. So this is the patient information and medical history for our second patients. For the second patient, the Case2. And now our Dr. Yang will perform the coronary IVL procedure on our second patient.
Yep, thank you. We just finished the angiogram for the lady, and we can see there are some stenosis at the LAD, the proximal, very proximal LAD, like distal lemon and the mid LAD. It seems it's not so significant like it looks in the CTA, but it is some eccentric stenosis. At this view, at the right shoulder view, we can see the distal lemon is quite narrow, and some heaviness. Also, as the mid LAD. And the circumflex also has some stenosis at the proximal and mid-distal segment. It's kind of a focal. This view is more clear. The vessels are tortuous. And for the right coronary artery, I'm sorry, the catheter is deep seat, and the proximal and the distal, as well as at the distal bifurcation, some focal stenosis there, and the vessel wall is kind of calcified over here. So this time, I decided to treat the right coronary artery first. I just deliver an short tube AL1 and plus L, SAL1. That's the regular guiding catheter we use for transradial approach, transradial access, right coronary artery intervention. Here, we got some calcium at the signal at the right sinus around the coronary artery ostium. Here the pressure is fine, but the pressure is quite high. Okay, let's check 0. 0 is good. Now the blood pressure is around 200. 你有冇咩唔舒服啊？哦，有嘢嬲你個面係嘛？你平時血壓幾高㗎？平時啲血壓幾高㗎？係啊，130、140啊。依家係咪有啲緊張啊？我依家冇啊。係咩？好痕啊？哦，好癢啊？我睇你有冇起疹？有冇皮疹啊？冇。The patient's blood pressure is quite high, but the patient feels fine. So I'm going to get some nitro. 来，给点消肝，小燕，给我点消肝。She feels nothing discomfortable, but a little bit itch on the face, but really nothing. The skin looks good. It doesn't seem like a allergy. Okay, always deep seat. Okay, always deep seat. I'm going to deliver the advanced wire into the coronary artery so I can kind of pull back the guiding catheter. This is a 信用 right? 信用导师是吗？是不是信用 ？Okay. Well. I'll give some nitroglycerin. 哦，这了200是吧？300吧，300。300 micro nitro. I'll give it into the coronary artery. Well. Okay, let me check again the angio. Okay. It's fine to go to the PDA if all we have to. Let's go to RPL. 我的指引已经出来了，没什么问题。All the vessels are open. Just the pressure is unstable. Now it come up.
导播那边把那个画面切一下吧，现在还是在这个 IVUS 的画面。We're gonna use 2.5
Yep.
IVL balloon. So Dr. Yang is going to use an guide extension Gazilla along with 2.5 IVL ShockFast balloon.
Yeah. I'll try use the Godzilla to bail out. I'm not sure if the support is enough because the IVUS catheter cannot cross the stenosis. The proximal segment is a kind of bend, and stiff. Now to prepare the ShockFast balloon, we need a 3-way stock. I'm not sure if this kind of IVL balloon can cross the so stiff and bended stenosis Just let's try. Now it's smooth. It's very smooth. Okay, let's go. See? It was a deep seated guiding extension. No, it's quite hard. Godzilla in, ShockFast a little bit in. Oh no, I don't think we can cross. ShockFast in. If we get the M+1, but not short tip AL, maybe it work. But here, okay, I think it's too tight. Hopefully, the regular balloon can cross. God bless me. God bless me. Oh, God bless me. Oh, huh. Oh my God. Ah, the regular NC balloon. This is. We need some more X4. Can we cross? I guess we did. Oh yeah. 记录吧。Are we deep enough? Let's check. I just pull back the extension just a little bit test. Yeah, I think we crossed. Okay. Let's pull back here. Okay, open up. 来，这个接上来了。对，好，7、8，下来。Is here the position? No. We should go back some. Ah, 下来。7、10。We can see there's still some waves over here. 12。Okay, done. Open it. 记录。Okay. Now let's shock it. Seems we get crossed. The waist is here. Okay. Let's go up. 打了4。对，打了4个大枪。好，不一样。被我撑开了。是。I'll double hit the button. Now it's shocking. One round is 10 beating. Finish. 到6，打到6。OK。下。 记录一下。Move a little bit. OK， 好吧。不4就好。Ball atmosphere are inflated. Now double hit the button. IVL is beating. There's a bubble in the 打了6。下。In the very distal tip. OK， 保持负压，保持负压。不动。I'll check the angle. Yeah, it's open up with some dissection. It is there. Lumen. Is it dissection or side branch? Okay, it's a side branch. It's not dissection. It's a U-turn side branch. Okay, I'm sorry. There's a side branch. Now, in terms of the very distal segment, if I can go, I don't think it's easy to go. The distal, to cross the distal stenosis, since this is an IVL balloon with electrode inside the balloon, a bigger profile, and also this is an open up a second-hand balloon. It's hard to deliver deliver the wire to the very distal. No, I don't think. Too many side branches. Hard to pick up the main branch. Anyway, no, I don't like it. Very slowly, it can cross. But I'm concerned if it can go to so much distal. 没问题，我是撑开了那个。I don't know. No, the guiding was set into the left ventricle. The guiding prolapse. It's not good. Oh, the Godzilla cannot get deeper. Godzilla also gets stuck over here. Oh, 我知道。No. The plug is quite stiff. Okay. I'll just go a final try. Deliver my IVL balloon. If I can get cross, it's very good to shock it. Oh, shock fast. Sometimes we can never be fast. No? You get stuck here. Okay, I'll leave it. The UG balloon. Okay, deflated. The UG balloon gets some difficulty to cross the. Okay. Oh no. Huh. That's the regular balloon. Let's say NC, regular NC broom. No. No. Okay, give me a brand new 2.5 broom. You can never cross. Okay. I'm concerned about how to deliver the stand. Come on. This is a brand new 2.5 NC broom. Bit by bit. Can we go? Oh. The extension cannot dip seat anymore. Let me dip seat the guiding caster. And if I can overcome, I have to use the semi-compliant broom. Seems it gets crossed. Pressure is good. Test. Is it here? We passed. I passed. Yeah, here, come on. 起来吧。7、8、10。啊 That was a waste， 是吧？记录。啊，下。Okay, can we get cross again? Yeah, we get cross. Okay, once again, please. 来，起来吧。14、16。啊，记录。啊，下吧。Let me try to dip seat. Okay. 来，起来。16。啊，下吧。come on. Okay. 记录了哈。好，这个球呢？啊，复阳。等一下，我再给他来点照影机。来跟上来。Okay, let me try again. Some resistance to cross. Always like this. That's IVL. That's IVL broom. No. 两个大枪，然后手。Inflate and deflate. No. 知道，被我堵住了，堵住了管子，不是堵住血管。It's going down. Going down. Come on, come on. Okay, seems here. It is at the position. Okay, 起来了。4 Release the tension，记录一下。Okay. Double hit. Now it's shocking. .没问题，没问题。OK， 停下，记录。OK， down，记录。好，再起，达到6。Now go to 6 atmosphere。好，下，记录了。OK。Now I'm pulling back the balloon. 好，这样保持不动，先不动。Okay. Is it open? There was some dissection at the distal stenosis segment. Yes, it is there. my goodness, a delay in the PA view. For this case, the stenosis is quite tough. Even the used non-compliant balloon cannot pass with the support of guiding extension. So we use 2 brand new non-compliant balloon to pre-dilate. We went to not very high pressure, like 10 or 14 or something. Okay. Now it's smoothly let the guiding caster get in. Okay. I'm a little bit pull back the extension caster. Hopefully we can record all the vessel. Okay. Okay, pull back please. 保存一下。Okay, at the very distal, let's eccentric calcium. That I don't think we touch this. That's the very distal segment. Here is some dissection. Some spotty calcium. Here is some plate calcium. And something like a noodle. Yeah, a little bit protrude to the vessel lumen. Okay. And yeah. Okay. Okay, eccentric calcium. I think that's why we cannot pass. 記錄一下這裡。依家好深嗌係嘛？有啲深嗌係咪依 ？OK， 我知道嚇，得啦。OK， the pullback is finished. It went to the IVUS limitation. 哦，又好了，又好了，又好了，又好了。I'm consider about if we should go to shock the mid segment. Because there is some eccentric calcification over there. 好啲啦嘛？好熱啊！依家咧 依家好啲嘛？这里吗？等一下，不用我手动就好了。I'll manually pull back to identify the. OK, menu. 不用记，不用记。Here there's some eccentric calcium. Here. Okay. I think here is where we dilate before. Here is where we dilate before, I think. Yeah. Okay. 出来了。比較難做啊，醫啊，你血管係咯，係啊係啊，依家攞出嚟啦，係啊，妖冇理由嘅，OK， 我知道。At the head knees, here at the head knees, there is some eccentric calcification over there, but I'm not going to cover there. So I think I'll try to leave it around. And stand the proximal and the distal segment. OK. 多出的近段多出，对，OK. The lumen, the diameter of the lumen is 3 something. OK. 多长好一点呢？3，对，先把近端盖了吧。18够不够？3.0 18，20还是18？20 OK。3.0 20的支架。I'm going to pick up 对，30 by 20 millimeter stand to cover the proximal segment first. I hope with the stand-in, we can deliver the guiding catheter deeper. So easy to deliver the second stand. For the distal thing, I'll avoid the bifurcations. I'm not going to touch the seam behind the bifurcation. I may need to deep seat the 改机了 hopefully. Okay. Go with the heart beating. I succeed. 冒烟 ，pull very little。冒一点点，一点点。OK。好，一点点。OK， 起来吧。10。12。哦，要低哈。下。When I deploy the stent, the patient suffers some chest pain. OK， 我记到了哈。3.0的高压。干嘛？对。10。12。下。记录吧。I need to handle the Godzilla. Try my best to avoid the touching of the Godzilla to the stent. In case it will shorten the stent. And after this, 远段的话要用多长好啊？23是吧？好的。直径也是3.0吧。2.75是吧？2.75乘24了。准备2.75、24的支架。According to my measurement of IVUS by my friend Dr. Hu, I'm going to pick up 2.75 by 24 stent for the distal segment. But before this, I'm going to post-dilate the proximal stent with the 3.0 broom, NC broom. That's a brand new one. Okay, it's in at the distal edge. I think so. Okay, it's still in. 起来吧。20。Okay. I went to 20 atmosphere. 去吧。26。For the middle segment, because the resistance very high, so I went to 26. Keep it. 不，再来，再起。Now I go to 26 atmosphere and keep it for a while. Make sure the stent was well opened. Okay, here is the proximal edge. It is come 来起来吧。好的，24、26。好，下吧，记录。Now I'm trying to deliver the guiding extension to see if it can cross the, oh my God, the non-compliant broom. That's the non-compliant broom, the used one. It's quite hard. Oh my God. 来，2个大气压吧。2 atmosphere. 下 and delete and push. delete and push. I hope my my guiding extension can go. No, I don't think so. It's not easy. 一个大气啊。Okay, one atmosphere. No. 下吧。The guiding caster cannot get in cross. No. I'm afraid it's shortening the proximal segment. It's in. 在支架内了哈。Cannot go. 啊，起来，两个大气啊，四个。Ball atmosphere to anchor. Then I get the guiding, the extension gets in 啊，下，记录。So I deep seat the guiding caster, the extension caster to facilitate the delivering of the second stand. The pressure is acceptable. 80 something. Okay. But diastolic pressure is not good. 27. So I need to be quick. My nurse is reminding me. It's reminding me. Okay. We get it crossed and pull out the guiding caster. Now is safe. Okay. Let's take a rest. Take a deep breath. 等一下，我退一点点。Pull back a little bit. If see the guiding. Okay. Extension. Is this the good place? Good. Maybe we should go for the proximal. 冇喐冇喐，冇喐吓，冇喐吓。嚟，冒煙。It's okay. 來，保存。要不要退一点点？要不要退一点点？可以。没有，远端不动它，我们可以再退一点点，好吗 ？OK，I'll pull back a little bit。你说第一个支架吗？第二个支架是吧？好，冒点烟。近端可以，远端离那个 PDA 有一点距离。其实我们可以再近一点，24有点长了啊，起吧，起10。12。啊，下，给我2.75的高压吧。OK。 So far it's good. Yeah. Okay. 275 non-compliant. Cause that's the calcified lesion, so we always go non-compliant post-dilatation. 那个外州的那个病例，外州的病人来了吗？在等着了是吧？some trouble. It is some trouble. Okay. Some trouble for a non-compliant room, even though this is a brand new one. 打起来，两个打起来。好，下吧。I'm not sure if the proximal segment of the proximal stand is well expanded, is well apposition. 记录一下。Once again， 来，起来，打了2，打了2。好，收。OK。inflate and deflate， 来记录一下。Here I'm going to the distal edge of the stand. Okay, well, where is it? Where is it? Where is it? Just here? No, half from there. 来，起来。20。20 atmosphere. 20. 24. 26. Okay, down. Down and push the balloon in. Is it in? Sorry. So why is it in? Hit the proximal first. Well, where is it? 是在边上吗？进去了一点点哈。OK， 对，26。好，记录。好，下记录。能不能往里走啊？哈 ，vessel is bent. I don't want to tipsy again the guiding extension. So maybe we just leave it. I guess we can iverse it. 来，两个大气啊。好，回收。2 atmosphere. Deflate and go. No, this time it doesn't work. That's where I can go. Okay. I will sit. I hope my iris can go. Man, come on. Oh, my eyeballs. Come on. Getting crossed. 过了是吧? Okay. So I'll pull out my wire to clean the iris view. Okay. 来，记录吧。走吧。Yes, there is still some calcium. Here, that's the distal edge of the stent. Looks not bad. The middle segment we post dilate with the 275 by 26 or something. But still there is a waste over there. At the distal mid portion of the stent. Here is the segment between two stents. Some calcium over here. Eccentric distribution. The room is a little bit small, but I think it's acceptable. Oh, okay, here there's a, yeah. Here's where it looks haziness at the angiogram. Okay, the proximal stent is also well expanded and well apogee. 拿多一个新的短的2.75的高压给我。Okay, the proximal stent cover everything. Oh, wait. There is still some calcium calcium nodule there. 多长的 ？OK， 第一个也是12是吧？那个径段还可以吧？径段贴壁，径段边缘的贴壁，这个可以是吧？OK, so far the two stents looks acceptable, except for the distal stent have a waist at the mid-distal portion. So I get a brand new 275 balloon to try to hit it again. In terms for the proximal stent, cause there is some calcium nodule. The expansion, the cross section of the stent is not very around at some cross section, but it's what we can do, I think. 这里面积多少？Okay. The minimal stent area for the distal one is 4.5. I think this is also why I go to OK 单数给吧，给个1000吧。I'll try my best to hit it. 是在接近远端的是吧？中远段的是吧？最窄的地方应该是在中偏远。OK. The minimal lumen cross section is 6 to 7 millimeter from the distal edge for the distal stent. So I get one more brand new 275 NC to hit again. After this, I think we can just leave it. And for the proximal stent, because we dilate up to 26 atmosphere, that's what we can do. We did all we can do, I think. So I'll leave it. I hope this one can go. Oh my God. still get stuck. Ah. Huh. Huh. Mainly resistant. Not only the stem segment, but also the calcium native vessel wall. So many resistance. No, I can never get in. 有没有更短一点的，亲爱的？有更短一点的高压吗？打2个大气啊。好，回收。进不去更深。进不去更深。My gradient, no. My gradient collapsed into the LVOT. We didn't get a short high pressure balloon. It's difficult. Support is poor. Actually, 10个大家。Support is poor. Resistance high. So much resistance. 来下。起来吧。好，下。再起。再起。好，下。There is some PVC. No, I don't like it. 好，起吧，26。26。Okay. Now it's 26. 26 atmosphere. 保持。好，下。I think we 支架边缘在哪？对，我们是26。这个方向有没有更短的？没有更短的球囊了是吧？对。Okay. Get cross. Get cross. That's it. Okay, come on. 起来。不用了，可以了。当，下来。它向前滑了，记录一下。When inflated, slipping. So I need to pull back a little bit. Let's see. 16。好，下。记录。再退一点点，现在支架内了吧？好，起来。I pull back a little bit. Go to 20. 20。好，下。And a little bit back. 好，起。 26 Now 26 atmosphere 啊，下记录吧。Hold my wire, hold the caster, and inject something. Pressure is good. Okay. Go into somewhere, please. Yep. Is there some dissection? Maybe. But now the guidance is in the side branch. Okay, it looks fine. Let's go Iris. How is the proximal? Hopefully that's the final Iris. Okay, 冲一下。Sorry to take so much time. 过了吗？还没有，刚刚过是吧？过了是吧 ？OK， 这是远端的概况，好吧，回测吧。对。OK。No dissection is better expanded. OK, stop， 停吧，停。好，我拉回来再看那个近段的哈。近段的那个支架在哪里？没事，不用进太深，我拉回来一点。还在支架外吧？这是过了，我要近一点点。OK， 好，开始吧。Now I'm checking the proximal span. Make sure nothing deform, nothing shortening. I don't like this, but we have done what I can do. Okay, it looks not bad. How about the aorta? Make sure nothing dissection. So let's go to the very okay. Everything's fine. Yep. Pull out the IVUS and set the Godzilla and one more shoot. 我们刚刚做了个造影了哈。That's one shoot. We're going to take a second. Sorry. The second one. Let's go this way. Godzilla, please. Dips a little bit. Make sure it's well. The feels. Oh, sorry. The Godzilla is dangerous. Is it okay? 那个近段有没有夹层？就接近开口几个毫米的地方有没有夹层？支架外，接近右冠开口，接近右冠开口。望远 ，OK， 没有是吧？没有夹层哈。你从10个毫米往回走吧，就往前走10个毫米。I double check the IVUS，OK，OK，好，就这里开始走。 I double check the IVUS to make sure there are no dissection at the very proximal segment. Cause I saw there's a step at the bottom side of the right coronary, but it's fine. Okay. I'm going to take out everything. 做好了，阿姨。不做，下次再说。三副在了啊。OK。We still have time for Dr. Dong to do a peripheral case. 直接拔就行了。对，不，里面那个东西直接拔。对，对，可以了。杨能文收一下那个，收一下那个机器吧。
So our Dr. Yang has just finished the second intervention procedure using our ShockFast IVL. Now we wait for Dr. Dong to perform another peripheral IVL procedure.
Sorry, my friends. I spend too much time to do too much detailed things. I'm sorry. Please take a seat. Take a seat. This case look like not only because of the calcium, but also the bending of the vessel. I think that's also because of the distribution of the calcium. Proximal at this way, distal at that way, so the lumen get the bend. So it's quite difficult for the IVL balloon to cross. Even for the regular non-compliant balloon, the used one cannot cross. So I use the brand new non-compliant balloon to pre-dilate up to 12 or something atmosphere, open up some space, and with the Godzilla to deliver.
Choosing the IVL balloon size.
Okay, I chose it according to the reference vessel. The reference vessel, like for the proximal. Okay, there's something compromise of the reference vessel and the sick and the sick lumen diameter, because at that place it's very narrow. It's very narrow. The reference diameter for me is 3.0, absolutely at least 3.0, but because it's very narrow and very bent, so I try my best to use a small balloon, no matter non-compliant or IVL balloon. I use the small one. So at first, I need to get cross.
Congrats, Mr. That's a great case.
Thank you.
But
Thank you.
Alternatively, maybe first in the setup, we choose maybe M plus left catheter, and your wire is Sion. Sion, yes.
No side hole.
Sion. Sion.
Sion.
Yes.
Yeah,
Maybe we choose the Sion blue extra support wire, maybe.
Oh,
because
maybe.
tortuosity.
Yes.
And then secondly, when we choose the IVL balloon, in the generally 1:1:2:1:0 ratio optimal IVL. So in the first, the narrow calcification and tortuosity vessels. So first delivery is not good with IVL balloon due to the 0.5 you choose, but maybe first time we choose a normal semi-compliant 2.5 balloon, mildly predilatation, and then we deliver it to the over the extra support via the bigger size IVL balloon. Maybe we choose.
I totally agree with you at this
Yes.
moment. You know what? I underestimate the resistance of the patient. At the very beginning, I saw sortive N plus left one. Sortive, I mean the SL1 is enough. Usually for the regular case, we use this kind of guiding catheter. But as you mentioned, it must be much better to use a regular AL1. N plus L guiding catheter will get a much more support. Yeah, that's it.
Secondly, you very good demonstrate to the balloon anchor advance to the anchor cerebral guide extension. At the end of you distal anchor inflation after then you delivery to the guide extension. Very good. Thanks.
Thank you very much. Thank you very much. That's very much. That's really my pleasure to discuss. And I'm also starting with you, my dear friends. With the extension guiding catheter, I just keep in my mind, must be gentle, be careful, don't damage the not to damage the stand.
But at the end of when you deliver it to the guide extension,
Yep.
you deliver it into the distal stand.
Yep.
But you fully
Yeah. Of course. Because when I
maybe
dipsy,
after you again post dilatation balloon, you again use to the guide extension.
you know what?
Easily. Yes.
Yeah. Yeah, you are right. You are right. But you know what? When the deep seat got the extension catheter so distally over there, the blood pressure is going down. So
Pressure is damping patients.
yeah, it's
not to the-
damping.
Okay, I
There's no time for me to put it there for any long. Yep. Thank you very much. Thank you. Oh, thank you very much. 谢谢谢谢 How to say 谢谢 in Turkey language? How to say it? 哎，好的。